I believe this patient put me on a Facebook group, and the rest is history. Today I did a podcast, and it was an interesting podcast, and I told them that I was doing a Instagram live tonight, and they encouraged me to share what I had shared on the podcast. So, for those of you who don't know or are just learning about some of the types of things we've done at our clinic and in my career. So I'm Dr. Whitfield. I'm in Austin, Texas, a board certified plastic surgeon. And the majority of my career was spent really training to carry out complex reconstructive surgery for cancer. And that was a ton of meaningful work to me, and I was very passionate about that. My sister passed away recently of breast cancer, and the large majority of my career was devoted just to cancer reconstruction for head and neck cancer, sarcoma reconstruction, and breast reconstruction, and those were some of the most meaningful experiences I ever had. So that led us in 2016 to be approached by a breast cancer patient who wanted to go flat. And so going flat and having an aesthetic flat closure is more common now than it was previously. I did her case, and I did all these cases the same way as I was trained. And so when I was trained, we removed all the scar tissue and sent it off for two things. One was an analysis to look to see if there was any residual cancer or recurrent cancer. And the second was to look for bacteria, fungus, mycobacterium. Those are things you would find on the microbiology reports. And this patient in 2016, at a week, we saw the patient. She had no evidence of recurrent cancer, which is first and foremost the most important thing when you take care of those patients. And second of all, when we reviewed the microbiology report, she had an E. coli infection. And she had no redness, no swelling, no pain, no tenderness, and had no evidence of capsular contracture. But it was something that was super frustrating to me. I didn't, or had not at that point in my career, ran into somebody who had a quote unquote silent or indolent infection like that.